How do medical institutions handle skin cancer screenings? When it comes to skin cancer screenings, medical institutions have established methods to ensure early detection and effective management. The primary approach is through a visual examination of the skin. This is typically performed by healthcare professionals, including dermatologists and trained medical staff. During this examination, the clinician looks for any suspicious lesions or abnormalities that could indicate skin cancer. These screenings can happen during routine health visits or at special skin cancer screening events organized by medical institutions. The visual skin examination involves a thorough survey of the entire body surface. Clinicians carefully check for unusual moles, growths, or lesions. Their expertise is crucial in distinguishing between benign and potentially malignant lesions. Research indicates that the sensitivity of these examinations for detecting melanoma ranges from about 40% to 70%, while specificity is quite high, between 86% and 98%. This means that while the examinations can effectively identify many cases of skin cancer, there are still instances where some cancers may be missed. Many medical institutions also participate in public skin cancer screening events. These events can be free or offered through healthcare providers and are often supervised by dermatologists to ensure quality. In these settings, physician assistants and nurse practitioners may also assist under the supervision of a dermatologist. This collaborative approach helps to maximize the effectiveness of screenings and provide patients with access to expert evaluations. In addition to professional examinations, patients are encouraged to perform regular self-examinations of their skin. This practice helps individuals detect new or changing lesions. However, current evidence does not strongly support routine counseling for self-examination in adults due to unclear benefits and potential risks. Counseling about minimizing ultraviolet radiation exposure is another key aspect of skin cancer prevention. Medical institutions often target children, adolescents, and young adults with fair skin for this type of counseling, as they are at higher risk for developing skin cancer. For adults over the age of 24, counseling is more selective and based on individual risk factors. Despite the widespread use of visual examinations, there is still insufficient evidence to conclude that routine population-wide screenings significantly reduce mortality from skin cancer. The balance of benefits and harms of such screenings in asymptomatic individuals remains unclear. As a result, recommendations for universal screening can vary. Emerging technologies, such as mobile applications and artificial intelligence, are being researched for evaluating skin lesions. However, these tools are not yet established or recommended as replacements for clinical examinations due to limited validation and accuracy data. In summary, medical institutions primarily handle skin cancer screenings through visual examinations conducted by trained professionals. They also emphasize patient education on UV protection and self-monitoring. While these screenings are crucial for early detection, current evidence does not definitively show that routine screenings reduce mortality. Therefore, screening strategies are often tailored based on individual risk and clinical judgment, with public screening programs supervised by dermatologists to ensure quality and accuracy.